Hello and welcome. Our promise to you is to bring you the best presenters from around the world, and that's what we have for you today with Dr. Yair Maimon presenting Treating Trauma, Shen, and the Dark Side of the Shen. This is to help you get even better results in your acupuncture practice, so it's with great pleasure I introduce to you Dr. Yair Maimon.
Hi. Well, first maybe I will just introduce myself and my background and what I'm currently doing. So I've been actually practicing acupuncture for almost 30 years. I was really lucky to study with the best practitioner and finish different aspects of Chinese medicine, from 5-element to TCM to stems and branches, Japanese acupuncture. And I was there like at the beginnings of the 80s where everything was happening in England, then moved to the States, and then did a lot of studies in China. I did in-depth study in different subjects, different topics like gynecology, children's disease, oncology, and what I will touch now, I think it was really my inspiration topic, is the spirit, or the way the Shen and the body interacts, or treating psychological diseases, or really in a way answering a much deeper question of why we are here, why there is suffering, and what it means from a Chinese medical point of view. So on one hand, my interest is totally in the way we interact with the Shen, or the whole concept of heaven, man, earth, and what it means. On the other hand, I'm very much based in medicine, also Western medicine. I was the head of a medical unit, complementary medical unit in a hospital for 15 years. And the last 3 years, I have actually a whole center for studying cancer, and especially the effect of Chinese herbal medicine on cancer. So I have my own laboratories and facilities in Sheba Hospital, which is the biggest hospital in the Middle East. So on one hand, I'm very interested in the Shen, and on the other hand, very interested in the Jing, or the most material and substance. Cancer is to do with substance, and everything to do with psychology, or the way we interact in the world and with the world, is to do with the Shen. So these two very extremes are my interest in Chinese medicine, and to find out from both ends the importance of being a human and the importance of being a Chinese medical practitioner. So this is, I'm located in Israel. I have also a very large practice, and I'm still on top of doing a lot of research, especially, as I said, research in cancer, teaching around the world. I'm still very focused on treating patients on a weekly basis, and to me, treating patients is always my passion and the way I can be inspired and feel I'm fulfilling my role. So thank you for watching this webinar. This webinar will be focused on one of the topics which I think is the most interesting, because it's to do with the dark side of the Shen. We are all the time focusing on what we think is the Shen, or our connection as human to heaven. But the suffering and what separates us from our inspiration is actually the dark side of the Shen, or as I later call it, a Gui, or different aspects in us that are producing suffering. And let me start with an interesting slide that I put up. And I've asked, with this picture that you can see on the slide, I've asked different doctors and practitioners, what do you see in this little child? So the medical doctors, the pediatrician that I asked, they say, oh, it's a failure to thrive child. Maybe have some disease, Russell-Silver-Dorf, like a disease of not being able to develop. And, well, it's not very well developed. The Chinese medical practitioner says, oh, look at his ears, his face, it's a severe Jing deficiency. And what's more interesting, and this is, I think, what we look in Chinese medicine, that in his eyes you see some fear, and you see sadness. I say almost he looks like he saw a ghost, you know, he's almost like afraid. He's not very well connected. You know, there's something in him which is very kind of coming from a point of being almost fearfully kind of gazing at the world and being a bit separated from the world. And let's just look for a moment at the models and systems of medicine and come back to this child and come back to understanding more about the Shen and Shen and Gui. So if we look more on medicines, especially if we look back on shamanic medicine, we see that man has been separated. In shamanic medicine, the approach was that whatever disease a person has, it comes from outside of him. There's either earthly spirits or heavenly spirits. There is things above human that are influencing his life. And he would go to the shaman. He would try to communicate with the spirit. He will be like someone like that intervenes and help you to satisfy the spirit and get you better. So human illness was, especially mental illness, was very much understood as coming from outside of himself. In Western medicine, we have another extreme, that everything comes from the body. We have to find eventually the cell or the mechanism of action of disease, and we are a totally separate entity from the world and from anything around us, and everything is to do with logic and with our ability to understand what goes in the body. From a Chinese medical point of view, we have a real unity. We see men as being in between heaven and earth. In a deep way, man is taking the call of heaven, bringing it down to the earth, and taking the answer of the earth and bringing it back to the heaven. And everything about Chinese medicine is to do with this concept. If we look about in a more deeper kind of alchemy way, it's the fire and water. And heaven is to do with fire, with the Shen, and the earth is to do with Jing and the water. And everything about us is the interaction of Shen and Jing through Qi, which is the part of man. So all our life are subjected to this meeting, of heaven and earth meeting, of Shen and Jing meeting, starting from the very first meeting at birth or at conception, when there is a meeting of Jing and Shen, and ending up in the end of life when Jing and Shen separate. And actually not Jing and Shen, but also Hun and Po, as we will learn later. So everything to do with human life in Chinese medicine are this deep interplay of heaven and earth, or Shen and Jing. As Western people, it's very difficult for us to understand. I mean, it's easier for us to understand the logic of Western medicine, and that's why we immediately look in Chinese medicine into syndromes and patterns and dampness and heat and pathogenic factors that are creating something and taking them out and taking them in. But the real depth of Chinese medicine, and if we look also in Chinese medical classic, will be all the time an interplay between heaven and earth, an interplay between Shen and Jing. And if we want to understand life, and later if we want to understand also suffering and death, we have to go to that level. And fortunately, Chinese medicine gives us the ability to diagnose and treat on that level. So the real aim, and if we look at through the classics and through the discussion, especially in the Neijing and Suen, it's a discussion of the Yellow Emperor with his doctors discussing Shen and Jing. They don't discuss dampness and cold and heat. They do, but in a very lower level. They'll always refer to some higher order that makes men on earth. And therefore understanding disease and understanding human life, and as I say, especially when we go to trying to understand the emotions and what we call psychology, it will always refer to these aspects. So the three treasures in Chinese medicine is always Shen, Qi, and Jing. Heaven, man, and earth. And when we do acupuncture, we work on a man level, we actually move Qi. That's what eventually acupuncture is doing, is facilitating this natural movement of Qi. A lot of time patients ask me, and I'm sure everyone who is practicing Chinese medicine, you get the same question, do you have anything in the needle? Do you have any substance you put in the body? But really, we don't. And when we use acupuncture and acupuncture points in a very deep way, we are actually helping the person to go on their path, on their Tao, to connect better to their Shen and Jing. And when we do that, we create a healing process. When a person goes off his path, there is a disease, or there is suffering, or there is strange things that go through one's mind, obsessive compulsive disorders, certain deep depressions, or whatever you experience, in your mind, it means that you're going off your path and your natural ability to connect to your own deep inspiration and Shen. So Chinese medicine, and the uniqueness of Chinese medicine, is to do all the time with understanding the depth of human life and our ability to connect to the Shen. And even the points on the body, they refer to it. I mean, just taking, for example, the gallbladder 13, Ben Shen, the root of the spirit. And there is a chapter also called Ben Shen, rooting the spirits, or the root of the spirits. And it means that certain points in the body, especially the points that have Shen in them, have a specific access to treat this level. And the gallbladder relates to the wood, relates to Hun. That's why it's such a long pathway. I mean, why the gallbladder gets so many points, and it goes all around the head. The more we go deeper into the alchemy behind Chinese medicine, into the Taoistic alchemy, the more we understand the role of Hun in the body, then we can appreciate and understand why the gallbladder goes to the eyes and to the ears, why our senses to appreciate the world are so related to the gallbladder, and the gallbladder relates also to our ability to make proper decision, to be properly on our path, and relates to the wood element, etc. So the more we unfold Chinese medicine, the more we realize that every aspect of Chinese medicine goes deeper into understanding of the working of Shen in the body and the working of the elements on earth. I like some quotes. This is actually from Rooted in the Spirit. It's a beautiful book by Elizabeth Rocha de la Vallée and Father Lar, talking about this chapter, Ling Shu 8, Ben Shen. So it says, the Shen is heaven within us. It conducts us and guards us, but also we must guard it. Because there is a mutual relationship. The more you do things that guard the Shen in you, the more a person is connected to his own Shen, the more the Shen is guarding you. The more your life will go on the right path. The more, I always like to call it, the more lucky you are, the more the right things will happen to you, or you will be able to see them. And Shen is very much to do with the inspiration of heaven in a person. It reflects this ability to connect to deeper and greater things than us. And again, in the light part of the Shen, we see the genius. We see our ability to connect to beauty, to art. We see humans' ability, and each one ability to connect to healing, to being a great healer. But then also, in the genius, you have the dark side. When the person is totally strange, his mind goes in a very unordered way. So we'll always see the light, the Shen, and a lot of time it's darkness and the strange things that goes with it and the suffering. The Shen is important both in diagnosis and in treatment, and in my mind it's impossible to practice well Chinese medicine without having it all the time present in your clinic. And again, if we go back to this little case that I presented, and if we look deeply into the eyes of this child, we see there is some, what I'll call prenatal fear. There is a very early on in life experience of some fear. And we see Jing deficiency and water and kidney deficiency. And a lot of time, the type of problem people develop are to do with their weaknesses and deficiency. So like in this child, it's very much something prenatal, some prenatal weakness or fear which is there. And like if I would use a point for him, it will be, for instance, kidney 24. Again, it shows you that this kidney water meridian starts from Earth, kidney 1, and goes up, transforming the Jing into the heart. So all the last kidney points on the chest have an interesting name, like Sheng Feng, Spirit Seal, or Ling Shu, Spirit Ruin, or Sheng Sang, Spirit Storehouse. So suddenly you get this point, kidney 23, 24, 25, which are expressing this change of Jing into Shen, fire, water into fire. And I would use with, like in his case, theoretically, this point, because this point will really help to reconnect him to his deep essence, the deep Jing, which is in a state of fearless, which is without fear, which helps him to be again strong in his Jing and his kidneys and being fearless in this world. So each one of these points is obviously having a different effect on the body. They're all connected to the Chong meridian, to water, and being able to transform water into fire. Each one can be used differently, and they connect differently, the kidney to the pericard and the kidney to the heart. And this point, especially for prenatal traumas and fears, can work in a very transformative way. And acupuncture is a very transformative medicine. And here you can see this little child that was transformed into this strong man. And it means that everything is possible for humans. You can see how his chin grew stronger and his Jing developed. So obviously he got the right type of treatment when he was a child. And if you know him, this is Gabriel Garcia Marquez. This is the pictures from his book, beautiful book, Living to Tell the Tale. And you can see how people can transform. So every time we diagnose the Shen or we observe the Shen, it is necessary to examine the eyes. Not just the eyes, but the eyes mainly, but also the complexion of the person, the movement. But the eyes especially, they are reflection of the 5 Zangs. They are reflections of the Wu Shen, of what goes in the body. They will show the inspiration, they will show the pain, and they will show the Gui and the separation and the darkness. You know, when someone is very depressed, you look in their eyes and it's like they are not present. And that means they are in a dark side of a Shen. They are not connected to the real Shen. They are connected to some darkness. And a good acupuncturist knows how to examine the complexion of his patient. But it is sufficient for him to look at the eyes in order to know the state of the energy. This is from a chapter from Ling Shu, number 3, and it points us all along, by the way, the classics, that the discussion of the Shen on observing and treating the Shen is the core to this medicine. In a Taoistic approach, Shen or Shen Men, the same name as we give to Heart 7, Shen Men reflects, Shen Men means the door to the Shen, the entrance to the Shen. And Shen Men refers to the eyes being the gates and to the Shen, that we can actually through them observe and see the strength and the pain on this level. And when I say strength and inspiration and spark, it means the light side. When we look at the dark side, when we see the pain, the suffering, the fears in this case, then we see the darker side, or this disconnection from the person's ability to connect to his own Shen. And again, Heart 7 is one of these amazing points that can help people to connect in a proper way. As we'll see on many meridians, we have this point that especially points us to that level. And I'll give another small case, because for me, I think, and especially for clinicians, cases are very much bringing alive the essence of the medicine, and in a deep way, they are also showing us the clinical reality, because we are not theoretical. We always want to bring the theory of Chinese medicine into practice and alleviate the suffering on a practical level. This is actually a picture of a patient of mine, also someone that I know, and I treated also his mother, and after his mother died, he got into a very deep depression. into deep sadness. And you can see in his eyes, you can really see this deep sadness. And this is already a month after his mother died. But also in his early childhood, he experienced some death. And when he was and this is again a very deep sadness. He was part of a twins, and when he was born, he was alive. The other twin was dead. And again, you would think an embryo doesn't remember, but it does. It does have some deep memories, and whenever again death will be triggered, it will take a person off balance. And when we talk about trauma and trauma on that levels, this is like a whole subject which I always like to talk about is the prenatal traumas. They leave a deep mark through all the person's life. And then whenever they meet the same trauma, something deep will happen to them. So for him, his mother death was, although, you know, they had it was a slow death, unfortunately. She had cancer, so he had time to separate from her. And it seems, you know, that after a while he should go back to himself, of course sad. But he went into this deep depression and totally got disconnected. Couldn't function anymore, couldn't work. And as you can see in the picture, you know, very deeply sad. So from the aspects of light, he was connected to the darkness due to very early prenatal trauma and another trauma of losing someone near to you, someone you love. So with him, I treated, and it's a whole concept of treating ghost points. Ghost points are first introduced by Sun Simyao, one of the most amazing practitioners. And he talked also a lot of using these points for coma, for epilepsy, for mania, but also which is like an obvious place when someone goes into coma, he's disconnected from his Shen. Or if you look at epilepsy, you know, you really look like a person gets an attack or gets inside him some kind of ghost. You know, they're not connected anymore. They move, they shake, they close their eyes, they foam. But that's a very extreme form of Gui. By the way, Chinese medicine treats very successfully epilepsy. I had quite a few cases. And a lot of time using concepts coming from Sun Simyao and using the ghost points. So in his case, in order to ease this deep trauma, and when you go to deep trauma and the dark sides, you need to use unusual treatments and unusual points. So in his case, I used a point coming from Sun Simyao, point prescription, the 13 ghost points. It was GV26, and it's the ghost point to treat the lung and to treat the paw. And it comes from a whole list of points, of the 13 ghost points. And when you look at these points, they relate very much to the paw. And this brings kind of the concept of Gui. Because when we are born, actually the Shen immediately gets two assistants, Hun and Po. The Po will follow the Jing all through the development of the embryonic life. The Hun will come in relatively, I mean, there's different texts around birth or at birth or immediately after birth or a few days before birth. It doesn't matter. But it means that it comes in a later stage. And the Hun follows the Shen. Hun and Po are the earthly ways or the earthly spirits that actually we can connect to. They are the yin and yang of the Shen. It's still before the Wu Shen, the 5 Shen. And both of them have the character Gui in them, which is a very interesting concept, you know, like spirits. And the Hun has the character Yun or cloud because it's more connected to the Shen, and when we die it will go up. And Po has the character White, and it's more connected to the body, into the earthly, into the feeling, into the lung, and it will go back with our bones when we die. So Hun and Po are the important concept when we are born and when we die. The Yi and Zhi come later on in life, and the Wu Shen, the 5 aspects of the Shen, are activated much more when we are conscious, when we are in life. And there is a beautiful explanation. It's actually from a gown that was discovered in this digging in China. It's in Mawang Doi excavations, and it's a gown of this. She was the wife of the priest, not the priest, the princess, the prince. She was the princess or the wife of the prince, and with her body, it was covered with this gown that explained all the different aspects of what happens to the spirit after the person's die. And you can see at 2 points. The lower one is the part of the paw. We have the 7 parts of the paw, like having a feast. And above it, you can see the hun and the deceased women with 3 aspects of the hun. And this is on the process in the gown before they going up to the heavenly part, which is the upper part of this ceremonial dress or gown that she was buried with. Another beautiful picture of the 3 hun, the 3 hun and the 7 po having a discussion, and it explains a lot about the depth of Chinese medical understanding about the hun and po. The hun with our ability to imagine things, and the po with our ability to think it out and bring it into the material world. And that's the yin and yang aspect, the deep yin and yang aspect of the Shen. Later on, with the same patient that was in this deep depression from sadness, I used one of the points which are called windows of heaven, Tian Chong. They're mentioned, that's 10 points that are mentioned in Ling Shu number 2. And I use Lang 3, which is the point for the lung. And all these points have the heaven name in them. They all treat the mind and Shen. They are located around this area between the man part and heaven part of the body. They are very much to do with our divergent meridians, with our ability to perceive the world, with our senses. They are all associated with different deep organs and the way we can sense the world. All the divergent meridians are opening up to the senses. And senses, it means also our presence in the world. The more we are present, the more we can sense properly what's going on at the moment. The less we are present, the more we are occupied with something, or our mind is like cut away from its source, the less. It's like people who are depressed. They are not aware of self. They are not aware of their surrounding. They are even not aware of their body. They can go very dirty or neglect their body, neglect everything around them. So this point are helping this. Again, it's one of the group of points which are to do with connecting a person back to heaven. Usually we treat them also with source points, so you can do Lang 3 and Lang 9. That's what I did in his case. And for me, Chinese medicine, and especially acupuncture on that level, it's a medicine of transforming people, transforming them from their deep pain and suffering into their potential, connecting them to their own path. As a practitioner, I can never know what's the path of the person. He knows it. His spirit knows it. He has the ability to connect to that level. If I do a proper treatment, I'm helping this natural process. And everyone who is a practitioner knows it. Patient after treatment, they look different. They glow in a different way. They are connected in a different way. Different things are happening in their life if the treatment is done in a proper way. So in a way, in transforming this negativity into positivity, in transforming the darkness and bringing light in, this is the deep aspects of Chinese medicine. And this is a slide that actually I took another picture of him, and I do very fast kind of snapshots in the clinic that shows the transformation from being disconnected and sad into having his Shen back and being happy again. Actually, after the treatments, he had a very deep dreams, and he told me in one of them, his mother came in and hugged him, and he cried from sleep, and he properly said goodbye to her. And he felt that there is some deep sadness at him, that by this hug, was revealed and was kind of transformed or opened up. And suddenly he got up in the morning and felt different, felt connected back to himself, having back his vitality. But also his deep prenatal trauma, I think, in a way was healed. If you think about it, it was in the womb of his mother that there was these twins. So there is some kind of, there's a lot of things we see and we know, but most of what goes in life is in darkness. We don't see it. We can say in the unconscious. We can say it, we can use different terminology. But there is a lot of things which are seen and a lot which are unseen. So I think him connecting back and going through this like conscious separation with his mother also healed a much deeper pains that stopped him all his life. And actually, as I know him and I'm following up, from this point, a lot of other things in his life changed. Actually, he got married and other positive things for him happened. And just a few kind of last words about the Shen, and then we'll leave some time for discussion. One of my mentors, I was lucky to have a lot of very good teachers. One of them was Father La, and I like to quote him. He had a very deep insight into the Shen and into Chinese medicine. And he says, grasping the Shen is like hunting. You must follow its hiding and escaping. It means you must be very attentive in the clinic. You must be very focused, you must be very open, and you must create a space. When you do create a space, you start to see it more. And you start to see more the light side, and you see more of the dark side. This is from a beautiful book called The Way of Heaven. And again, if you look at the classics, so in 25, it says, in order to make acupuncture thorough and effective, one must first cure the spirit. So again, all the classic indicates that towards this direction. And in Ling Shu chapter 9, the first chapter that talks about 9 needles and 12 source points, it says the ordinary skill of acupuncture maintain the physical body. The high skills maintain the spirit. And now comes a very interesting quote, use the spirit to reveal the spirit. So as a practitioner, you must also use some part of your own spirit if you want to connect on that level. And as I said before, and I think it's a very important notion, everything we do in the clinic must take the Shen into account and must refer to it. And the concept of Shen is really the strength of Chinese medicine. And in treatment, if we again look at the classic, it will say all proper needling first treat the spirit. As we said before, so in 25. Those who use the needles must not forget the spirit. The spirit seems to be at the tip of the needles. Focus awareness on the patient. This is again from Ling Shu 1. And I like to give another nice quote from Rooted in the Spirit. The great acupuncturist is an artist and a wise person with a generous heart. His hand is guided to a space of the body where the spirit is rooted. The acupuncturist will himself be guided by his own spirit. He calls heaven and earth to the point where their meeting give birth to life. I think it's a beautiful way to look at the deep aspects of Chinese medicine and acupuncture. In treatment, we need to create a change. And I think one of it is to focus not so much on the problems that need solutions, like the symptoms, but at the potential of the patient that needs to grow. And when we choose an acupuncture point, we need to think of a point which will make the patient grow. And we have to understand deeply both the patient and the point that we can use in order to create transformation. And for me, just ending up this part of the webinar of the slides before going into a discussion, I always say good spirits stay with good people. And for those of you who are watching it and continue to watch it, from Shen to Shen, thank you very much.
That was a very deeply inspirational presentation, and I do have a couple of questions which I'd like to ask you. One of the
Sure.
things you talked about was, obviously the focus being on prenatal trauma. And for people who are in their adult life coming to see you as an acupuncturist, what process do you go through to define or explore the nature of this trauma? Could you take us through perhaps some of the diagnostic steps and the discussions that you go through in order to find out that information?
It's almost present there from the beginning. And so to me, observation, first of all, is the first diagnostic process, because not everybody has prenatal trauma. So to focus where the pain of the person is and where it's rooted. So if I'll see, and we look first of all on the, I can say the 7 emotions or the 5 most prominent emotions. And if we see sadness, we'll start to ask the patient about what he thinks is the root of sadness in his life. And people, I'm teaching all over the world, and usually I like to teach with live cases, the same as in the clinic. It's quite amazing how it will take 1 or 2 minutes from observing the pain of the person, asking him specifically about it, from him to revealing something very deep. And that means it's not prenatal, this is something that should be postnatal. He will be actually aware of it. If the person is not aware of it, or sometimes underlying, well, we continue to ask, why is this fear so big for you? You just, maybe something small happened, or everybody goes through hard times in life. Why didn't you cope with it? Then they can go deeper, or sometimes then they will either remember, sometimes they ask them, I have this, again, another story with sadness, and I saw it in a patient that actually had fertility problems and couldn't get pregnant, but it was so obvious. And I asked her, is there something very deeply sad or that happened to you in your childhood? She said, no. So I said, well, ask your mother. Her mother was still alive. Maybe there was something during pregnancy. And then apparently her father was in the army, and when she was pregnant on the 7 months with her, he was, how do you call it? They couldn't find him. There is a word for him. He was notified as, do you know the name in English?
So, missing in action, MIA.
Yeah, missing in action, yeah. So he was missing in action. So imagine a mother, she's on her 7 months pregnant, and her husband is missing in action. And it took a while. It took like a month, So she really mourned him. She was grieving, And this goes into the child. And when you look at the person, you see that there is some sadness. She's not aware of it, but like in her case, she could ask her mother, and then we could find out that the root was prenatal. So the idea of asking, first of all, seeing it present in the room, then so observation is the first thing. By the way, creating the space is the second thing, listening or smelling. And then asking, is the third thing, palpating is the last. This is the 4 pillar of diagnosis. So this is for me kind of the steps that I would take in the clinic. And later, obviously, look at the pulse, try to see the depth of it.
And could you take us through then a little bit more information about step number 2, creating that space?
It's so natural for someone to choose Chinese medicine and so forgotten. I think the most beauty of treating someone is usually one of the only place that sometimes someone is listened to, or is coming to a space which is totally created for him for healing. And I think the more we allow it to happen, and for me it's literally just sitting and listening, but not just to the words and not to the physical sense, but to the root, to the Shen of the person, what it wants to express. Once you're in your mind, you're at that kind of, I don't know what's the word will be, focus or just awareness, something happens. And this is all, to me, it's a clinical reality. I hope it gave you some answer.
And I guess I'm wanting to learn from you. What skills would an acupuncturist need to have to be able to develop that? You mentioned earlier that just in asking a few questions within a minute or two, you've been able to help the person identify the root cause of their sadness. That to me strikes me as something that, with your 30 years of experience, that's something that you've developed. Can you help us to understand perhaps how to hone those skills, how to develop those skills more quickly as a practitioner?
I'm teaching something, which also came up through conversation. It's called 1 minute diagnosis. So I'm teaching. I always saying I'm teaching for 8 hours, 1 minute diagnosis. So, and I think almost everybody has the skill. They just have to kind of allow or have enough confidence in the medicine to use it. So I think years of experience are helpful, but even beginners, as I said, I teach by now hundreds or thousands of people. And I find that if you allow it, if you trust yourself as a practitioner, if you are deep in Chinese medicine and you're very keen into it, you will allow the skills to develop. Obviously, being inspired by other people, seeing it more in action is helpful. But I think the trust is a key word here.
The other thing I wanted to talk with you about was, you mentioned your patient who had fertility issues and that you had traced that to prenatal trauma when she was 7 months old with her father missing in action. What would be then an appropriate course of action? How many treatments might you advise, or do you have, when you're diagnosing someone with this sort of dark Shen type presentation, do you have in your mind how many times you might need to see them in order to help them through that process?
I would give two extreme scenario, because I don't think there is it a lot depends on at when do you meet the patient, and when do you meet the patient, I mean in what time in his life and ability to transform you meet him. And this actually go through the 7 and 8 years of transformation. I mean, it will be different if I'll meet a 14-year-old girl or 49-year-old woman. And in a sense, actually, sometimes the older the people, the more they are mature to transform. Sometimes it will be few treatments. I like to see it as block as 4. Sometimes it can be 4 treatments, 8, 12. So this is a kind of good time to see real deep change. And this 4 treatments will be good to do once a week or once every 2 weeks, and then maybe following up by another once every 2 weeks or 3 weeks. So we get into like around at least half a year to more framework with 8 to 12 treatments. And usually 1 year will be a good time for someone to go through a process which will sustain him for life. But sometimes even 1 treatment. I teach, and my teaching is 1 needle technique. I like to use 1 point a lot of time. And you use 1 point once, and the whole transformation occurs. So overall, you would look at the block of 8 to 12 treatments as creating a real transformation, then maintain it or help it to kind of stabilize it with another 8 treatments. So it can be over a year. But, it's very much you flow with the case. And I think the first 4 to 8 treatments are the key ones.
And interestingly, you sort of answered my next question, which was whether you do use point combinations. But you've already said that you generally only use 1 point per treatment. Do you use other techniques?
I tend to use. Sorry, Sorry, I was interrupting you.
Well, that's right. I was just sort of asking you. I was trying to understand what it would be like having a treatment for a condition like this. So you're using 1 point. The next part of my question was whether you use other techniques like moxa or cupping, or is it really just the insertion of 1 point for the whole duration of the treatment?
I'm quite purist, and if you think about it, I always bring up the concept of homeopathy. You use one remedy, but you actually just use the energy of the remedy. And you give it in a very, very diluted form. So you really give the pure essence of this energy. And by triggering something deep in a patient, huge transformation occur. So there is so much in little. And we see it all across. The more fine the energy is, the more it is tuned, the more you are in the right frequency, the greater the change. So actually, when I use many needles, I want to create less change. And I want maybe to work more on the body level. When I want to create a real deep transformation, my tendency is to use one and focus on one needle. And obviously, this is an art. I've been teaching it quite a lot, so I think it's forgotten art. There's still a lot of traces also in Chinese medicine of using one needle, but in practice, it's quite amazing that the less needle we use, the stronger the treatment, especially if you want to summon the powers, the deep healing powers in the body. So I can use 3 needles or 5, but I tend to use less. I don't use a lot.
And I have another question for you about what sort of things are people presenting with? So I don't imagine somebody walks into your practice and says, I'm 40-year-old man carrying deep trauma from the loss of my twin at birth. What type of things are people coming to you for that you're then seeing that there is this deep-seated dark Shen trauma?
Anything. It really, as I always say, people ask me what kind of patient to bring you to a seminar when I teach it. I say bring anyone, back pain, whatever. A lot of time you will find behind a physical problem or trauma. Obviously, I treat a lot of oncology patients because, as I said, I'm specializing on the physical part. I'm specializing in herbal medicine and in oncology. And as I said, I'm deeply involved in it on the very physical. So obviously, in cancer patient, there is a lot of deep things surfacing out. But even as we saw in fertility, in a lot of cases of what people will think is a pure orthopedic case, once you see it all the time. I think that at least 60 to 70% of the patients are coming to us, they're coming with a deeper request and a deeper pain. They're presenting with symptoms, but I hardly mind the symptoms. So I don't think it's, obviously, if someone is depressed, but I treat a lot of people with mental problem or what we call psychological problem, but also a lot of people who think they have a physical problem. And we are human. This is our story.
And it's been interesting, while you've been presenting today, in the background we've heard a number of sirens. They're either ambulance or police. Yeah. And it's made me think about that.
I'm living next to the hospital.
No, so this is it. So it's made me think about this idea that trauma can also happen at, unexpectedly. That for those people today who, unfortunately might need to be visited by an ambulance, how would something like this concept, this dark side of the Shen, look at someone that has been through something like a car accident or some very deeply traumatic experience?
That's a very good question, because this is actually, if you go to ER room, you will see that one of the main problems that people have is the trauma. They are disconnected. You speak to them, they can't answer. You look at their eyes, they don't see. They are not present. All these are aspects of Shen, or being disconnected from one's Shen. Actually, now they do a lot of research about trauma and mass trauma, and they found that one of the most important things that Western medicine is so lacking is the ability to reduce this kind of deep shock and trauma that happens to people. And I was treating in hospital a lot of, also in the rehabilitation department. I was the head of quite a large unit, so we had different acupuncturists in different departments. One of them was the rehabilitation. And one of the main problems in rehabilitation that people always say is sleeping problem. They have huge difficulties in sleeping problem. And you'll just treat simple treatment to reconnect them through their trauma. And then they're sleeping better, then the whole process of healing gets faster. So as we will see, treating trauma and treating the dark side is in a lot, much more aspects than you realize, it's actually everywhere. And as I say, I'm living not far from the hospital that I'm working in. That's why you hear some of the siren passing by. And obviously, when we go to ER room or when we treat oncology patients, it's so present. And I think one of the best things we can offer them is actually relief on that level. It totally changes the whole their ability to get rehabilitated faster, to feel better, and whatever they have, their healing is being quickened. And obviously, they're happier.
And my question is, do you have specific points or treatment approaches that you think, again, would you then go back to the Sun Si Mao ghost points if the trauma was a recent trauma as well? Is it the same framework that you apply in your clinical process? What
I was referring to, Sun Si Mao points are a great point. There is many more points. I mean, when you treat on that level, you must use points in a slightly different way, sometimes slightly different techniques. And obviously, we are like a short webinar, so we can't present them all. But Sun Si Mao points will be an interesting and a good place to start. That's why I wanted to kind of open them up. But again, you have to use them in the proper way. But you can use almost every point. I would say, if you just want to do something, even your awareness, your needle awareness, your diagnosis awareness of the patient, probably with lung 9, you can also transform. So depends how deep you want to go into, but acupuncture is transformative medicine. When you're aware of it, then you can use a lot of points for this transformation, and obviously for deep traumas, you can use a lot of guidelines that we go through the years with great and inspiring physicians like Sun Si Mao.
And now it's interesting too, a lot of what we've been talking about has been focusing on having somebody who is unwell and taking them through a transformative process to being well or improving. But of course, with all your experience in the oncology department, I imagine that would draw on a different sort of expertise of almost transforming somebody through a wellness process into being unwell to the later stages of dying. And we did a webinar recently looking at working with people during a dying process. And I was just wondering whether you have anything you'd like to share with our audience about being involved in that time of life and that incredibly transformative phase.
Okay, first, when you started the question, I thought you were meaning the opposite, to treat people who are relatively healthy and just want to transform, because that's another, I think, perspective. But for people who are dying, I think it's, again, it's sometimes the most deepest and the most opening place where a person is willing to touch his authenticity and his authentic pain and his authentic inspiration. And I think that by hearing the precise call, you can really respond with the precise treatment. And definitely in these cases, you would use 1 or 2 needles to help the person to transform, either to strengthen his deep connection with the Hun or the Po or the E or the G. People will tell you, there is these fears that are coming up. You would think about the kidneys. There is this love, which is being unfulfilled or is now coming up. So you think about points on the heart or the pericard. So I think being there, listening and being very attentive to the patient, you will understand what kind of treatment. And I always say it will be very simple, very small, very precise. And I think by doing that, you really help, and that's also my experience. You really help people to let go of life in a proper way, or to, and the sentence that comes to me is really to let go with dignity, not to go out with fear from this life.
I have a personal question for you. Everything you're describing, you're dealing with people who are in very deep levels of change. How do you protect yourself from a lot of the intensity of those situations? Given, that, as you said, you see people, you're currently very active in practice, you're working in a hospital, you're exposed to this level of intensity for a lot of your working life. What are your strategies for taking care of yourself?
The real answer is I don't know. I think that I'm not getting too emotionally involved, but not in a way that I feel I'm just doing my best. It's not me. We are just. I don't take it personal. I mean, as I'm trying to be the best acupuncturist and the best help for them. And I don't go into this personal, emotional level, because I'm all the time dealing with people with deep pain on different levels. And my role is to give them strength, not to be, and that's what they need from a practitioner. They need the inspiration, the health, they need to connect to their Shen and to their healing. So I know as long as I'm in this role, I'm getting probably protected, as we say, or strength myself. And if I'll get personally involved either in myself or in them, I think that's probably one of the places where people will experience difficulties from practicing.
It's interesting. One of the expressions which comes to mind in thinking about the way you've just been describing your treatments is that you're a facilitator of change. So that therefore that's exactly what you're saying, that or facilitator of transformation, perhaps. But is there anything else you'd like to share with our audience about your journey to that skill level, and perhaps advice for somebody that might be interested in pursuing this further?
I think that one of the main things as a teacher especially, or the two main things that I'm always trying to bring is, the first one is I think the trust in the medicine. I find that a lot of people who practice Chinese medicine are sometimes losing this strength and totally trusting the medicine and its abilities. So I think the more you trust the medicine, the better your results will be. And the second is inspiration. Chinese medicine to me is extremely inspiring, and is an extremely inspiring journey. And I think when you have trust and you're totally inspired with what you do, you will do well, and we will do what we should do as Chinese medical practitioners at this time on earth. So that's what I can share.
I think that's a wonderful note to end on. And again, thank you so much for taking the time to share with us these insights of your 40 years of the journey to Chinese medicine. And one of the things I'm looking forward to doing is working more closely with practitioners in Israel, because of course one of the things I've learned recently is that Israel is by far at the forefront of acupuncture integration, and certainly your experience running a hospital acupuncture department. And if you've got a moment just to quickly share with us some of that hospital experience, because again it's so unique to anywhere in the world to see how well acupuncture has integrated with mainstream health services. We'd love to hear just a little bit more about that from your perspective.
Well, I'll share with you one of the secrets. When I studied abroad, and when I came back to Israel, there were only 3 people practicing Chinese medicine here. And I was the third one. The other 2 were not, they were okay, but not very well trained. So I was very much at the birth of Chinese medicine in Israel, and we created a large school. So I was very much involved in this whole process of the growth of Chinese medicine and the integration both into the health system and into the hospital system. Health system as far as HMOs, the general practitioners, and into the hospital system. In most hospitals in Israel, there is some form of complementary medicine, with Chinese medicine is part of it. And it's integrated in all the HMOs, or the national care services. And it's just to do, I think, with the people here, and especially the medical system, being very open and young and interested. And I myself, I trained Western medical doctors in a hospital, and I trained almost 700 medical doctors, which helped a lot in integrating Chinese medicine back into the system, because there were a lot of trained physicians. A lot of them were not necessarily practicing, but were very then open. They didn't see it as something alien or strange, or especially they didn't look down at it. They thought it's a valid form of medicine. So this helped to integrate it, and as you said, in many hospitals now, Chinese medicine is available in different departments, or outpatients, or even inpatients.
Indeed. And well, it's certainly inspiring to have a model to work towards around the rest of the world. So Yair Maimon, thank you so much for your time today, and we certainly look forward to getting this message out to acupuncturists all over the world.
Well, thank you, Kath, for arranging it, for putting all your energy in putting it up for people who can't travel all the time around the world, but would love to watch things over the internet. So I know how much effort goes on your side, so thank you very much.
That's wonderful. Thank you again.
I hope you enjoyed this free webinar. Please take a moment to subscribe to our YouTube channel, and please share on social media. The world will be a better place when more people know about the benefits of acupuncture.